Right. Welcome, everyone. We're so excited to have you here today with us for our June Lunch and Learn titled Cultural Differences in Wellness. Lunch and Learn, Respecting Our Cultures and Individual Differences. We are so excited to have Hector Ortiz here with us. He is the program manager for diversity and inclusion at the Penn State Health Office for Diversity, Equity, and Inclusion. Before I pass it off to him, I just want to give two reminders. The first being that these are recorded, so if you are unable to stay for the entire length of the session or would just like to watch it at another time, we will be sending the recording out in a follow-up email, as well as placing it on our BeWell website. Secondly, if you have any questions or comments, please feel free to utilize the Q&A feature, and we will get to as many as time allows for. And so with this, I will pass it over to Hector.
Thank you. It is a great pleasure to be here today and share some of the things that we do in the Office for Diversity, Equity, and Inclusion, and particularly at this moment to share the cultural differences and wellness, how these two interact, how these connect in this Lunch and Learn. The topic of today is how we can respect our culture and recognize our individual differences and how we together contribute to the well-being of Penn State Health. Thank you again for the invitation. I hope you enjoy, and I would like to share what are the outcomes of today's session. Today, the purpose is to discuss the different aspects of cultural differences, to talk a little bit about individual uniqueness and collective differences in the workplace. It is going to be an overview of cultural differences and conscious bias and the intersection with wellness. The outcomes of today include recognizing cultural differences to better work with others, identify ways and reasons to appreciate differences, and understanding the correlation between respect, inclusion, and wellness. I hope we participate interactively in this session. Please feel free to utilize the chat. We have two persons who has offered to help and monitoring the chat and share any questions, comments, or concerns that you may have. Please use the Q&A chat or the chat itself in order to participate and interact. Let's start with a quick definition. We call a working definition of culture. What is culture and what it is so important, so necessary for wellness perspectives? The first one is that social pattern of behavior is a way to define culture. In other words, these patterns of actions are from our backgrounds, for our experiences, for our environments. Actions that influence what people think, say, and do. This is very important because culture is used as a template on how we interact with one another. Culture also creates behaviors, and those behaviors influence decision-making, proceedings, or how we interact with one another. That's what culture is so important, because in addition to that, culture involves traditions, behaviors, attitudes, language, thoughts, beliefs, values, and ways of communicating with one another. Culture acts, as I mentioned before, as a template. Culture helps to shape our behavior, and more importantly, our beliefs, and generation to generation are shared. And that's what culture is so intrinsically connected with the individuals, with the groups that we are part of or that we represent. Now, culture is not something simple. There is a big element of culture. And here is just a quick, short diagram of what culture means and the different layers of cultures. As you can see, the core differences of cultures come with the personality, with the individual, with each of us. But then we had primary, secondary, organizational, and different layers of cultures. All these cultures represent different groups, different individualities. And based on that, based on origin, language, family status, education, belief system, we can have different cultures. Two or more people create a culture. In that way, here at Penn State Health, we had multiple cultures. We have individual cultures, group cultures, organizational culture, and we are going to be talking and referring about that in the next couple of seconds. The other element that is connected with what culture is all about, and the intention of today is to understand a little more about bias. cognitive bias and unconscious bias. What it is important because we see it in society, we see here at Penn, we see in any department, because many times bias and unconscious bias can be perceived as nothing bad, can be perceived that you are just doing your job. And we're going to be discussing how those perceptions and assumptions can be interconnected with the wellness of any individual. Let's start with bias. Bias is a tendency to prefer or judge one thing or person over another. Now, bias is not necessarily good or bad, because, for instance, if you like football, you may be a fan of the Eagles, or you may be a fan of the Steelers. And in that way, you have bias because you prefer one instead of another. Bias is not necessarily good or bad, it's a preference. Bias is bad when you use that preference to create damage, to damage the integrity, the personality, the service, the healthcare opportunity that any person should have. That's when bias becomes an issue. Cognitive bias is an understanding of those events based only on their own experiences. In other words, many times we utilize some type of bias just based on my experiences, and we don't allow a space to interact with other points of view. Many times you probably have seen this before. There is explicit bias and implicit bias. Explicit bias, as mentioned before, is externally something that happens based on preferences. Implicit bias is something that we many times are not even aware how we are acting, how we are responding. Explicit bias means attitudes, beliefs, and actions, most of the time, if not all the time, conscious intent about a particular group, individual, or thing. In other words, explicit bias analyze, refer to all our attitudes, beliefs, and actions. And that happening in society, happening all the time. Unconscious bias, on the other hand, is a process when preconceived assumptions or mental associations, many times unconsciously, function without awareness, without intention, or without control. The more important thing of this is that these actions affect the decisions that we make. So let's put this in perspective. We'll see a couple examples later on, the connection between bias, unconscious bias, and wellness. But based on those decisions, we may be creating injustice in services for people who may be from a different color, group, ethnicity, origin, language, and many of those dimensions of diversity, dimensions of culture that we have. That's what it is important. That's what is to recognize bias and unconscious bias is fundamental. And we as a professionals, even if we are patient-facing employees or non-patient-facing employees, because we relate with one another, with coworkers, with all the workforce that we have, but also we relate with our patients. This is fundamentally important, not just to serve better, but also for our overall well-being. Any questions so far? Just asking if there is any questions, please feel free to put in the chat. But again, we have discussed so far about bias and unconscious bias, and just briefly talk about the different types of cultures that we have. Implicit bias, again, are attitudes that distress or create an understanding of actions, decisions that in an unconscious or subconscious way affects the way that we think and feel about others. So rationally and emotionally, in many ways, affect how we present to one another. That's what unconscious bias, again, we don't plan to eliminate unconscious bias. The main intention here is to be aware of those unconscious bias. And again, we're going to be seeing a couple examples later on. A couple more elements of unconscious bias many times is manifested in several ways, affecting how when things feel and behave. Social behavior is not completely under unconscious control. In other words, many times what we do may be managed, may be redirected for these unconscious bias stops. In other words, unconscious bias are quick judgments And that's when the issue starts. That's when the concern starts. Quick judgment about others, typically about others, based on what? Color, race, ethnicity, gender, sexuality, sexual orientation, sexual expression, weight, age, gender, and all the issues that we see in society. Many of those actions start as an unconscious bias in an unconscious way. Many times people don't see any issue with that. But when we utilize unconscious bias in a frequent ways, those unconscious bias become bias. And those bias may become segregation, discrimination, harassment. And all of those, as you know, are prohibited at Penn Health based on policy and are prohibited from the federal law. That's what we are here, to be sure that all these ways of action may affect not just the mental health, the wellness of others, but at the end is going to affecting the mental health and the wellness, the well-being of ourselves. And we will see those intersections later on during this presentation. Again, if we summarize what we have just revised today in unconscious bias, are associations outside awareness. That's what is unconscious. Associations outside awareness. Most of the time, any unconscious bias tend to be negative against some things that we may agree or may disagree. Negative evaluations of others. In other words, we are usually looking for just what is wrong, what is not working the way that I work, that is not in relationship of what I believe, or what is not the culture that I know. Those negative evaluations of other people generate stress, distress, and many other mental health issues. Start with stress. May start with fatigue, not just for you as the person who portrayed the unconscious bias, but also for the person who received the unconscious bias. Those preconceived negative assumptions affect the relationship. And if we just bring the right values to this equation, there is no way that we can have respect, integrity, teamwork, and excellence, the 4 values that we proclaim at Penn State Health, if we have these preconceived negative assumptions against others. Stereotype medical diagnosis, tests, and treatment happen many times based on unconscious bias. Based on the experiences that I have, I try to treat people like everyone else, and that's a mistake. Why? Because each individual is unique, each group is unique, and we cannot make assumptions and judgment, assuming everyone should be the same procedure, should follow the same prescription, because you and I know that doesn't work in that way. Make sense? That's what it is important, fundamentally necessary to recognize bias and unconscious bias in the workplace. Let's talk a little more about this unconscious bias, because again, we can expand on this. The purpose of this presentation is to go a little more deep of this unconscious bias. We talk about judgment, we talk about perceptions, we talk about assumptions. Let's focus a little more how those perceptions happen on a daily basis. Perceptions about people and situations based on assumptions, generalization, stereotypes. Again, perceptions, something that I think is real. I may be just based on my own experience. Let's just put an example of a perception from the patient perspective. There is a generalization that Latinos tend to be late to the appointments because you and I have 10, 15, 20, 100 experiences with a person from the Latino Hispanic background was late. I don't have any right or any evidence to say that the people who come from 26 countries representing more than 400 million people are going to be late and behaving in the same way like these 1,000 people. That's what I mean, that we cannot generalize because you had one experience or 100 experiences and then assume that everybody behave and act in the same way. That's unconscious bias. And we can, again, bring thousands of examples from each of the different dimensions of diversity, how we interpret and make assumptions and perceptions about others based on those experiences that we have had. Beliefs, attitudes, and behaviors are the way that we influence unconscious bias based on beliefs. If a person goes and prays 5 times per day, then we say, why they pray so much, what they need, what they don't work. That's unconscious bias. That's a judgment. And again, we can bring examples from the different groups and the different dimensions of diversity. Any questions so far? How are we doing? Are still clear? Are we moving forward? Please let me know in the chat if you have any questions or any comments. If you agree or disagree, it is fine. We are just sharing something that we know, something that we see is important, and again, in one way or another, affect the relationship from one another and the respect, integrity, teamwork, and excellence that we need in order to work with one another. Not just with coworkers, but also with our patients population.
Hey, Hector, we had one question asking if there were employee engagement committees for diversity, equity, inclusion, and belonging.
Thank you for the question. It's my understanding is if there are employee engagement committees. Let me tell you first that engagement is one of the issues that we face at the organization. We try to be more proactive in generate engagement. There is not something specifically that we call engagement per se, but we have many activities, many functions that are correlated with the intention to engage employees. We have town hall meetings, for instance, that many of those are based on diversity, equity, and inclusion. And the intention is to bring people together and hear from them the many issues that may happen in your own wards, in your own departments, in your own units. We have the business employee resource groups, which is an opportunity to come together and debate, discuss topics that may be interesting for each of us. We have several educational sessions like this one, when we try to interact and allow people participation to share if you have any issues coming of concerns that are related with DEI that we can help, hopefully, to resolve or at least present some ways of addressing those topics. We have, again, many other activities that we use in order to generate engagement and participation. The Upstanders Cafe is another opportunity that the Office of Diversity, Equity, and Inclusion offers on a monthly basis in order to interact and to discuss topics of interest, particularly unconscious bias and microaggression. Actually, for 2024, we are going to be enhancing that opportunity, and it's not going to be just talking about microaggressions and unconscious bias. It's going to be also an opportunity to discuss social topics that are from interest, not just for those particular groups, but for all of us as an organization to be addressed. For instance, let me just mention a few of those. We are going to be discussing the topics of fear, the topics of abuse, the topics of mental health, and many other social topics that is going to be relevant for the workforce and for the patient population that are going to be part of this engagement opportunity that we offer. I hope that answered, but if not, please feel free to share again anything of you would like to go a little more deep. But yes, there are many instances that Penn State Health offer these engagement opportunities. Again, I'm not going to be, probably we can spend another hour just talk about these different types of unconscious bias. The intention of this presentation is not to go deep, but just to share that there is different types of unconscious bias. As you can see here, affinity bias, confirmation bias, attribution bias, conformity bias, the halo horn bias, contrast bias, nonverbal bias. Again, we have different categories of bias that have been researched and studied in the last few years. And again, we're going to be sharing maybe a couple of those concepts with you today in order to recognize those who are more meaningful or relevant. But if you want to research a little more, please feel free to go and identify, learn a little more about all these types of bias. When we offer courses in unconscious bias, specifically in microaggressions, we usually go a little more deep with some of these concepts, and we put some examples of how they look like. I think we're going to be doing a couple of those today. Let's start with nonverbal bias. Again, based on culture, those nonverbal bias may be even misinterpreted. Meaning, right, shake hands, right? Typical at something that may be typical in some particular cultures, may be the opposite for others because they are not used to. So we make assumptions, we tend to believe and make assumptions that anything that my culture does, everybody knows and everybody should be doing. That's one of those unconscious bias that we have in the Latino Hispanic culture, for instance, to give a hand, to give a kiss, to hug people. It's typical. It's something that happened. It's not the same in the Asian culture, in the Japanese culture, the Korean culture. And we have to recognize that. We cannot make assumptions that what happened to my culture should work for everyone. Again, just an example. Even facial expressions are different, and nonverbal clues are different in the cultural background that we have in the world. Nonverbal bias or body language are essentially type of communication used below the level of conscious awareness. Nonverbal messages include body movements, facial expressions, vocal tone, and volume. How we use our voice. In some cultures that are very soft, they talk very slowly and very, very passive way. In many other cultures, they are very influential in the way that they talk. They use a lot of hands, like myself today, face expressions, tone of voice, and that's part of the culture. But those cultural backgrounds may be misinterpreted and create opportunities to present unconscious bias, and many times microaggressions based on those non-verbal ways of thinking. Any questions so far? The question that probably you are saying, okay, perfect, this is good. We know a little more about bias. We know a little more about culture, but how this is connected with wellness. Today is about wellness and how those connections take place. Let's see in the next slide. And that's what we are going to be now referring, how those interconnect, intersect, and why it is important for our well-being. These are what we call the dimensions of wellness and cultural differences, based on physical aspect, based on intellectual opinions, based on emotional viewpoints, based on spiritual and beliefs, based on social, financial, environmental, occupational. We are all different. And all of these contribute to the well-being of an individual. What happens is that based on culture, one of these elements may be more relevant than others. Based on culture, for instance, in the United States, the culture of the approach that you are as an individual be able to succeed by yourself, to respond by yourself, may be different to the conceptualization of culture that many countries like Latin America or Asia have, when the collective approach plays an important role, and many times even more than the individual approach. In other words, the physical aspect may be most important for some groups. The intellectual achievement may be more necessary for others. The emotional responses may be relevant. And those elements, based on the well-being of each individual, is going to be impacted by cultural differences. Again, beliefs, intentions, knowledge, financial support, and many of these aspects that create wellness. Questions?
No questions so far, Hector.
Thank you. Does it make sense? Is my question to myself. based on my culture. I may have some preferences, some priorities. The same will be with you. Each individual is unique. Each family is unique. Each town is unique. Each unit is unique. Each department is unique. Based on our professions, of our knowledge, we give some preferences to those. The rationality tells us that if we take care of all of those in one way or another, we can be better. We are going to be creating wellness, and we're going to be very prepared, not just to serve others, but to serve ourselves. That's where these dimensions of wellness and cultural differences intersect and interact. Now, why it is important? And let's see a couple slides when race and wellness don't work together and what that creates. Racism, probably you have talked many times about structural racism, race and ethnicity. And you can see here, based on research, that racism can interact with cognitive bias and affect clinicians' behavior and decisions. And in turn, patient behavior and decisions, example, higher treatment dropout, lower participation in screening, avoidance of healthcare, delays in seeking help, filling prescriptions, and lower ratings of healthcare quality are part of those decisions. Now, let me tell you, I don't know if you agree with this, but when we talk about patients, we tend to believe that this is part of our culture as healthcare providers. We tend to believe that patients are the others, those who come to see services. But are not we patients? Are not looking for well-being? We all are patients or are going to be patients in one way or another. So whatever we create for the well-being of patients, at the end, we are going to be creating for the well-being of us. Because in one way or another, any family member is a patient in this community, in this society. So think about that, how important it is to create this race, wellness, and patient care and connect, because racism and conscious bias affect all of us at the end. Do you agree? Can you please just respond in the chat, yes or not, so we can have an idea of how these concepts, these stops, move from the screen to our thinking process. Please share with me if you agree or not. Research on evidence-based facts also show that medical determinations can be based just as much as who a person is. Can you imagine that? Medical determinations can be based just as much as who the person is as on the symptoms they present. So many times it's not just the symptoms that the people bring, but based on appearance, language, ethnicity, and how people look. This is research, and that's the reference right there. The reality is that unconscious bias can lead to false assumptions and negative outcomes. A person can cope better with explicit and implicit bias or dealing with difficult situations, but adopting what we call the growth mindset instead of fixed what. What that means is, if we recognize that we learn, that we don't know everything, that learning is a process, and as a person who wants to create well-being, is open and flexible to learn, to absorb more information, we are going to be very prepared to create a better world. Social scientists agree that unconscious bias can strongly influence the way one evaluates and treats others. Again, we will be patients one day or another. And if we are not able to address the unconscious bias issue, we know that this unconscious bias will strongly influence the way we are going to be evaluated. Does it make sense? Does it make sense? A little more about unconscious bias in patient care. Implicit bias may cause medical staff, healthcare providers to unintentionally make assumptions. Keep this in mind, unintentionally make assumptions and create something that is even worse. Stereotypes, lower expectation for patients to comply with medication, for instance, wellness programs and follow-up regimes. Here come wellness again. Based on these stereotypes, we may tend to believe that a person of a particular color may be able to follow up with those wellness programs. Person from a particular group may not be able to comply with those particular programs. Unconscious assumptions that we make. That's why it is important to anyone who works in wellness, to anyone who is committed to wellness, to help to create that a strong belief that together we can really change the dynamics of the current healthcare situation. Because this is not about what they can do. It is about what I can do as part of the system, what I can do to really create the change that I would like to see. Make sense? People, fellows, coworkers. Unconscious bias influence care provider assessments, treatment, and procedures. We know that. And also influence patient care and disparities in treatment. Bias and discrimination may also negatively impact provider-patient communication and the trust that we need in order to lead healthcare outcome disparities. The trust leads to health outcome disparities. If there is no trust, there is not going to be a patient-provider relationship. So much needed. The question is what we can do. I mentioned a couple of seconds ago that you can take a lead. You can make the change that we would like to see. And that's the purpose of today's session, to try to generate some information that all of us can participate. Systemic racism influence clinical outcomes for children, for instance. And you have some of those outcomes: lower healthcare access, tardy disease recognition, unequal inpatient utilization. Recommendations that people do: conceptualize the impact of racism in health outcomes, structure a patient-centered data collection, and that's something we are going to be doing. 2023, 2024, we are going to be even educating and training how to ask those questions, particularly those questions who are related to social determinants of health, because those are so important and very predominant in the healthcare of the people. And inclusivity and adaptability in health equity research. Again, some recommendations, some of those are going to be implemented by Penn State Health when we start addressing a little more in deep health equity outcomes. Wellness programs and unconscious bias. For example, healthcare bias exists surrounding people with obesity. And if we start analyzing ourselves and just make a quick reflection, we know that that's true. In 2015, for instance, a study suggests that healthcare professionals can view people with obesity as, read by yourself, and please tell me in the chat, please, but let's interact. I would like to see, I'm not able to see the chat, but please, my coworker and colleague, Kanan, can help us. They said, according to this study, that people are seen as lazy, weak-willed, lacking self-control, and willing to follow recommendations, and liking to stick to treatments. Do you agree or do you disagree with this? Have you been in that situation? Has someone that you know been in that situation, and you can see based on those studies, is that true?
Hey, Hector, it looks like we don't have the chat open, so folks are putting their comments in the Q&A, so they're welcome to continue doing that, and I can read them off, or if you want to raise your hand, we can unmute folks, and then you can just vocalize what it is that you have to say as well. So we'll do our best either way. But so far we have two folks saying one says this is not true, one says I disagree, one says agree. And so so far, those are the comments we have.
All right, and just to be sure, this agreement is about this last slide, or that was presented before. I just want to be sure what is the topic.
I believe it's related to this slide. I'm not sure where, and that's the harder part with the Q&A. I know folks are saying they agree and they've experienced these perceptions, so I'm not sure exactly where they're agreeing or disagreeing.
Okay, good. Thank you.
Mm-hmm.
Thank you. Again, this is based on research, and this is based on studies. These 15 studies, again, as you can see from the Medical Today articles, basically these are common behaviors that people perceive or assume are part of these particular groups. And that happened with wellness again. Now, what we can do, what you can do, again, I have this circle of actions that we can do to better address this. Start with self-reflection. Again, just do your own research. Look for those personal bias. Look for intentionality. Are you really committed to address this? Look for what is the cultural humility. What is your culture? What do you think about other cultures? Attend ongoing training. We offer ongoing training all the time in order to address different aspects of diversity and these different aspects of culture. And again, you see, become an upstander and participate and intervene when it's needed. And for those who are monitoring this presentation, again, would be great if we can enable to the chat. I was not aware that the chat was not available. I apologize for any inconvenience on that, but it would be great if we can enable the chat. I think it's something that simply can be fixed. But again, thank you so much for your comments. And this is something that, again, what we can do. The second thing that we can do is to participate, to engage. Was a question related to engagement. And one of the suggestions that we have as an office is to move to be a bystander and become an upstander. What that means is, instead just watching the situation, observing the situation, participate and engage, and have a voice and share, even if you agree or disagree on how you can become an upstander, a person who goes against the tide, intervenes and protects a victim from injustice. And bystander is a person who does nothing, just pass by, observe. The framework of the Upstander Cafe very quickly is to interrupt, to make inquire, to echo, and to educate. We usually use this framework every first Friday of the month, and you are welcome to come and participate and know a little more how we can generate this opportunity. I would like to ask if we were able to enable the chat. Please let me know, those who are the organizers of this session. And we are going to be doing a case scenario to see what do you see in this case. It's not necessarily related to gender, race, or ethnicity. It's something that probably is connected with the well-being of any person, independently of the culture or beliefs that they may share. But let's see this scenario, and I would like to hear from you what you think.
It doesn't look like the chat box is able to be turned on while we're in the process of this meeting. So people, if they just want to continue using the Q&A, we'll keep monitoring that. Sorry about that.
Thank you. Would be great. All right, we had case scenario number 1. Please take a look, take a couple seconds and just comment, even in the Q&A, please comment, what do you see here? What called your attention from this situation? So the question is, had you experienced something like this? Had you seen something like this in another coworker or colleague? Or even outside work? What do you see? What will be a symptomatic approach? What should one do? Why should one intervene? How it is connected with wellness? Anyone?
Yeah, we have a few comments coming in, Hector. We have one that says, just simply asking if they need any help with the project. Similarly asking, hey, is something wrong? We have another attendee that says, they have experienced this themselves on occasions. Oh, now they're really flooding in. Okay, so we have another one that says, we need to ask our colleague if there's anything we can do to help them. Is everything okay? And another comment saying there seems to be a change in their emotional state. Start first with a friendly, kind check-in with their emotional state, before really kind of moving on to pushing forward inquiries about the project specifically. Let's see. We have another one. It looks like this could be a distress signal. If possible, would have someone else do the work and help this individual get help. Excellent suggestions.
Excellent. Thank you for your comments. I think the bottom line, or what I can see as across the line in the 4 or 5 comments that were read, at least one common element comes as a collective recommendation. I would say don't make assumptions, correct? Don't make assumptions. Ask could be the second one. Instead of making assumptions, just ask, what's going on? How can I help you? What happened? Tell me a little more. So ask. And how you ask, how you communicate is going to be very important. Probably you are familiar with these crucial conversations or meaningful conversations. That's important to learn how to ask that question, because based on culture, based on the emotional situation of that circumstance, the person may respond or may not respond. Trust is so important. Remember, we saw in a couple of slides. Trust, ask, offer help, don't make assumptions. I am missing anything? I think those common actions, recommendations came from those comments. Anything else that you see that probably is not there? At the end, remember, you depend portion of that project. You may be part of that. In other words, your performance may be affected because of your colleague reaction. So at the end, if we talk about the right values, remember, teamwork and excellence are specifically connected. And we should be able to ask, how to ask, to recognize how to ask from the cultural perspective in order to support the person, but also to support yourself, because your performance is in jeopardizing opportunity. We don't follow that. Make sense? All right, let's see a second scenario. Actually, the second scenario happened many times here, and it's a short one. Probably you will have the opportunity to relate a little more. Let's read. A physician who sought guidance for balancing their workload. The main concern was long-hour shifts, too much stress, and unbalanced work and life schedules. The physician was told that maybe the physician need to do a medical assistant job instead. So in other words, if that is too much, you should not be a physician, just do a medical assistant job. It's a lot of things right here that we can interpret, and I would like to hear from you. What do you see? What should one do? Why should one intervene? How is this connected with wellness?
So our first comment, which I have to say I absolutely agree with, is it's terrible advice. right? Maybe suggest that they look into getting a partner to help divide the workload. I think that that's a much more reasonable alternative to stepping down from being a physician. So.
Thank you, Kanan. And maybe what you are saying is this is not really an advice, right? Maybe it's a judgment, or maybe it's a stereotype, or maybe an assumption, right? What the person in the case is doing, I mean. When the physician was told, that's what I mean. Maybe it was a judgment, a perception, an assumption. A good comment. Yes, it is not a good advice for sure. What else? Do you see that they diminish the professionalism of others as well? When you said just do an assistant job, the medical assistant job, what do you see there? I see no respect for any other profession. I see the lack of respect for even colleagues that we had as a medical assistants. I see lack of respect to the physician itself. But what else you see? Does it affect the wellness, the well-being of these individuals, both the people who judge and the people who receive? What do you think? Do we have those cases here? Are you aware of those cases? Does this happen here? What do you think?
We have a comment not directly related to the question you just asked, Hector, but one of our attendees had said, I also wonder if this was said to a male or female. I feel it would be questioned more in a female, but then they go on to add, I guess I'm stereotyping as well. But that's a good point. I think it makes a difference, or it could potentially, right, given those biases that people have. And another attendee added, I also think that type of response should have follow-up with the supervisor or whoever made that comment.
Thank you for those comments. And remember, if we want to be inclusive, we don't know what the gender of that person may be. Maybe what is the gender would be a good opportunity, but maybe no, maybe a no. Maybe a member of the LGBTQ community who is not ready yet to share. And in that way, it is important how we connect, how we relate to one another, and respect even the cultural diversity that the person may bring. Assuming that it's just male or female, again, may be a way to exclude many others who are not part of this category. Just keep that in mind. Again, we had just a few more minutes, and I think the purpose of this was to share that this happened at Penn State Health and that we are encouraged to promote an opportunity to reflect on these cases and ask to participate, to engage, and to be proactive on how we can support one another and look for the well-being of us and others. Then the question is how we can address those unconscious bias in the workplace and what we can do. Avoid assuming or judging a person without knowing the full story. Please prevent peer pressure, like the one example that we just see a couple of seconds ago, and collect impartial and collective opinions from others. Ensure you capture the root of the opinions and preferences about a particular person. Because again, if those are based on facts or assumptions or emotional responses, then we have to be careful about the unconscious bias that we may have in our actions and decisions. The second element is that all of this can be correlated to mental health symptoms. And what I mean is that mental health symptoms can look different at work if we consider the context of the situation. What happens if a person is untidy appearance, frequent sudden and intense mood changes or temperamental, frequent unexpected use of PTOs, missing deadlines or meetings, withdrawing from social situations, lack of productivity, trouble focusing. All of these elements may be cause of concern in the well-being of individuals. That if we don't provide some opportunities to create well-being, wellness, that can intensify the situation and create healthcare outcomes. And lack of productivity, lack of participation, and many other things. So keep in mind, as a wellness organization, one of those elements is to be curious, to embrace the opportunity to learn and participate, interact early instead of waiting when sometimes it's too late. Turnover may be cause of this, and how we can prevent some bad situations happen. Let me state that what the Joint Commission says related to safety and action that we should consider. We should be collecting data on race and other indicators to self-assess and monitor and evaluate the effectiveness of the organization to eradicate inequities in care. We promote racial diversity and support positive intergroup contact. Remember this, positive intergroup culture, interaction with different groups. Implement and evaluate training and ensure that all employees have the knowledge and skills needed to prevent racial bias. Ensure employees and patients are treated with respect, understanding, and dignity. These come from the Joint Commission. These are mandates that in order to keep our status as a healthcare providers, we should follow. How we mitigate unconscious bias based on the Joint Commission? Awareness of our own bias. We start this session creating awareness of ourselves. Investigate and report microaggressions and unconscious bias. Scrutinize when prejudice, discriminations, and unfair treatment based on our policies take place. And justify any decisions that we made based on the investigation that have taken place. Again, these are actions that come from the Joint Commission. What is the wellness opportunity that we see to create a culture of inclusion? Why we should embrace a culture of inclusion? The first thing is each person is unique and has been shaped by the different aspects of diversity. This diversity means a well of opinions and perspectives. These distinctions help to build individuals and teams that are healthy, committed, and successful. That's what it is so important to create a culture of inclusion. Why it is important to create a culture of respect? Because we can learn about each individual. We can learn from one another. The appreciation of differences empowers better communication and better collaboration. And the diversity of perspectives can improve individual and organizational outcomes. There is a survey. If you would like to help us to fill it up, there is a QR code. And do you have any final questions? I think we have 3 minutes or so for any final questions or comments that you may have.
All right, well, some people might be typing their questions in. I just wanted to say a huge thank you to Hector and Kanan and the Office of Diversity and Inclusion. This was a wonderful presentation with a lot of valuable information. So thank you so much for taking the time out of your day to present to all of us. Just a few reminders, this recording along with the slides will be sent out in a follow-up email, so you can expect to see that within the next few days or so. I also wanted to promote our upcoming Lunch and Learns. We have one on July 11th, which is titled Emotional Intelligence. And then on August 9th, we are doing one that's titled Navigating the Return to School. So we have some good Lunch and Learns coming up. Also wellness related, I wanted to promote our BeWell, Be Active walking challenge or steps challenge. That's going to take place the month of July. So you may have seen that come through your emails yesterday, and you may see it in some other promotions, but we encourage you to participate in that. We're looking to do 10,000 steps a day or an exercise equivalent. So that could be swimming, gardening, yard work. We have steps conversion. So it's just a way to be active throughout the month of July. So we encourage you all to take a look at that and register if you're interested. I don't see any other questions coming through at the moment. Some people thanking you, Hector, for a wonderful presentation. But if you do have any questions after this, feel free to email BeWell@pennstatehealth.psu.edu, and we will forward them on to Hector. But with that, again, thank you to everyone. Thank you to Hector for this wonderful presentation, and we hope you all have a great rest of your day. Thank you.